Mwaka 2012 December ilikuwa tu uchungu wa kuumwa na kichwa. Nilikuwa na meza painkillers. Hiyo uchungu inarudi tu chini. Naendelea na shughuli yangu.
But after 3 months, 30-year-old Emali, a mother of one, started getting severe headaches.
Nilikuwa naenda private, wanasema ni malaria, wanampatia madawa. Kuna siku wakaniambia ni typhoid. Wakanipima, wakanisema ni pneumonia.
But the pain never disappeared.
Nilikuwa tu nimekufa moyo. Hata nikaona tu ni kama nimerogwa.
This went on and on for a while until
nikastuka tu nimekufa side moja ya right.
Ni ngumu. Unabaki kuwa baba na wewe ndio mama. Sasa changamoto nyingine mtu akikolapse. Unaweza amua sijui achane nayo ende kwa bibi mwingine.
With the help of community health workers, the couple decided to go to a government hospital where Emali was hospitalized. After several tests, they discovered that Emali had extrapulmonary TB that had attacked her spine.
When you get TB, the commonest area that the TB goes is in the lungs. And then from the lungs, a bit of it goes into the lymph node, the swellings that you get, like if you've got a sore throat in the neck. You can also get some in the lungs. They just go there, and after some time they get better by itself, especially if your immunity is okay. But sometimes it breaks into the blood. And once it breaks into the blood, it'll actually go anywhere in the body.
It's such a hard form of TB to diagnose and more costly. However, it's not transmissible.
Sometimes the body takes care of it and then it may just remain in one organ. It can be the brain alone, which you call TB meningitis. It can be the bone, which you call TB of the bones. It can be in the lymph node, like in the neck. You find that the neck sometimes is a bit of swellings in the neck with oozing there. The danger sometimes before it settles in an organ, when you just have fever of unknown origin, it may be difficult for us to know what kind of TB it is.
Patients suffering from this form of TB can still get infected with the pulmonary TB, which means he or she will suffer from the two types.
Pulmonary bidi tufanye scanning. It cost kama 22,000. Na maisha mtu wa kawaida ni magumu kiasi.
Kenya is ranked among the top 22 countries that collectively contribute about 4 out of every 5 tuberculosis cases diagnosed in the world. Today, 1 out of every 300 Kenyans has TB. According to World Health Organization, 9,500 Kenyans died of TB in 2012 alone. And as the world marks TB Day on Monday, concerns abound over extrapulmonary TB, which currently accounts for 20% of all TB cases reported in Kenya.
We don't know whether we are getting all the cases or some of them are hiding. So we are actually supposed to double the efforts.
According to medical experts, the rising burden of TB can be attributed to the increasing cases of alcoholism, people defaulting on treatment, as well as the rising numbers of informal settlements.
We link up with NACADA because most of our TB clients are drunkard, mostly men. Because when they go and they share a place where they are drinking, that's when somebody coughs and there is no window in that room, so it spreads, which leads even to relapse, and which we are fearing it might lead to multiple drug resistance, which is very expensive to treat.
Emali is lucky to have survived, having been on treatment for a year, taking drugs daily.
Wenye wako na TB wasikufe moyo, wakunywe dawa na watapona.
The fact is that many of us have probably been infected by TB, but we don't become sick unless our immunity goes down, either because of age, diabetes, cancer, HIV, or things like that. The only way is that you have to eat properly, and that is generally all the foods. Or if you have HIV, you take your ART, you take your medications without fail.
Now, TB can be fatal, but it can be treated if it's diagnosed early. But it's important to know that you should not ignore simple signs such as a simple but persistent cough or headache, because it could just be a sign for extrapulmonary TB. Violet OTINDO, K24 in Kangemi.